researched every plastic surgeon in the state of Georgia, all the surrounding states. Dr. Maloney was far the best choice, period. He was like the face man. I'm a glass half full person instead of a glass half empty. So I'm not thinking negative, I'm not feeding into it, I'm not thinking anything bad. We're positive all the way. So positive thoughts, positive results.
Hi, how are you? You must be KiKi.
Yes, how are you doing?
Nice to meet you. Welcome to the Maloney Center.
Thank you.
Dr. We're excited to have you here today.
I'm a little nervous.
I'm going to bring you in the exam room.
Okay.
Have a seat. Make
Right
yourself
here?
comfortable, yes. Dr. Maloney will be in. He'll examine you, talk to you about some of your concerns, and then he'll bring you into the consultation room.
Hi, KiKi. When KiKi first came in, one is captured and almost overwhelmed by her bubbling personality. What I'd like to do is let's stand up in front of the mirror and you can share with me in your own words some of the things that are a concern to you today.
Okay. All right,
Okay.
cool. All right. Well, the main thing, Dr. Maloney, are my eyelids. You see how it's all fat, puffy, and all that right there?
Mm-hmm.
That was really bothering me. Underneath, all these lines right there. Especially like these two big deep ones right there. Also this.
As we sat down and began talking about her concerns, the first thing I began to look at was her facial symmetry. Let me have you just follow my finger here. Now, you also have a fair amount of asymmetry or difference between the two eyes. The right eye is much more prominent than the left eye. Because of the prominence of the eye on this side, if you look at the distance from the upper eyelid to the lower eyelid, it's much wider on your right side than it is on your left side. And so I think if we can bring this lower eyelid up a little bit for you like that, then that's going to help to balance out the two eyes.
Can't make this one bigger. You know, big eyes are like, and that's like, I get the most compliments. They're like, oh, you got such big, pretty eyes.
Yeah, no, I can't do that. So let's talk about the upper eyelid area. You can just look in the mirror right here. We have a fair amount of heaviness starting to settle in along the upper eyelid area. We used to think of this in terms of a condition of older people. Nowadays we see a lot of people come in with as much upper eyelid heaviness. We just come in and I take out this extra heaviness, and that's going to leave you with a small incision that's going to be right in the upper eyelid crease, back along here. Now the lower eyelid, what I would suggest is that we make a little incision on the inside of the eyelid so we won't have any incisions on the outside. You've got beautiful skin here, we really don't have much extra. And by making an incision on the inside of the eyelid, I'm going to put a little spacer graft underneath there. This material is alloderm. It's human skin. They take all the cells out of it, they freeze dry it. And as we put this into your body's going to see this framework of skin, and it's going to grow into it and take it over. Right through here where the cheek tissue should begin to settle, the best way to bring that up is going to be to make a little incision on the inside of the mouth for you. So KiKi, I think we've got a great plan put together for you. What I'd like to do now is let's go ahead and we'll take a couple pictures. We'll put you in a computer imager. That'll be a neat little tool for us to try to show you what some of these changes might look like. In KiKi's case, where she has this hereditary fullness of her face and around the eyelid area, surgery is really the only option that she has available to help correct this. Diet is not going to make any difference in that, nor will exercise. And that's what we call intrinsic aging. Then there are other factors, extrinsic factors, such as cigarette smoking and sun exposure, that accelerate that aging process. Let's go ahead and we'll start making some changes here. Underneath here, we'll be able to bring this up just through a small little incision there. And with the liposuction along the cheek here, we'll be able to go ahead and help soften that.
Give my face like more definition.
Exactly. We're going to take away some of that roundness and we'll make things a little more triangular for you.
Now, is this surgery going to be more difficult because I'm African American opposed to Caucasian?
No, but one of the things people worry about with black skin sometimes is something called keloids. That's a condition where the body way over heals and it forms a lot of scar tissue. It's extremely rare in the middle part of the face, and with the procedures that we're talking about today. KiKi, that kind of summarizes our plan. What do you think?
Let's do it. Let's go for it.
Okay.
Alrighty.
Great.
Okay. Put my face and my future in your hands now, doctor.
You can do great.
Alrighty. The whole thing is just kind of exciting. I can't wait just to go ahead, do it, and make it happen. doing? I'm KiKi Henson.
Hi.
Are you from my surgery?
Yes, sign in, Miss Henson, and we'll be with you in just 1 second.
I'm crying. All right, girl.
Because you know I'm coming back.
I'm ready.
Good morning, KiKi.
Good morning, Dr. Maloney.
How are you today?
Oh, forget about me. How are you today? Get a good night's sleep?
I'm wonderful.
You get a good night's sleep?
Oh, you better believe it.
Eat a good breakfast?
You better believe it.
Okay. All right. I'm gonna make sure you're okay.
Well, let's talk about our game plan here today, okay?
Okay, I'm nervous. I'm nervous.
Everybody's a little nervous at this point, and that's perfectly normal. Okay. KiKi is going to be undergoing a upper and lower eyelid blepharoplasty, facial liposuction, and a mid facelift. You shouldn't really have much pain. You have some numbness, and that'll feel a little funny, and you have some swelling of your upper lip.
Okay, I think we're about ready.
Okay.
Are you all set?
All set?
As I'm scrubbing my hands, they're actually scrubbing KiKi's face and are going to begin to put the sterile drapes around her in preparation for the procedure. For KiKi, the procedure is going to seem to take only seconds. In reality, it's going to take us a couple hours to do. Well, the basic rules of surgery is measure twice, cut once. So we're just going to double check our markings. What I'm doing is pinching the upper eyelid skin to determine how much we want to remove. This little scleral shield is going to help to protect her eye. This is human skin that they've taken all the cells out of, and we're left with just the framework of skin. This will be the graft that we wind up inserting into the lower eyelid to help hold that up. Sometimes in a week, these incisions are difficult to spot. One of the beautiful things about the eyelid skin is it's the thinnest skin on our body, so as a result of that, it heals very quickly. Because we want to really reduce the number of potentially visible scars and reduce our skin incisions, our surgical plan is involved several small incisions. With the elevation of the cheek tissue with the mid facelift, we're going to do that from up above through the lower eyelid incision. For the liposuction underneath the chin, behind the ears, with the lower eyelid area, we're going to make an incision on the inside of the eyelid. For the upper eyelid, we need to make a little incision and it'll be placed right in the upper eyelid crease for her. Yeah, perfect. Okay. This dressing is going to give us a little support for all the underlying tissues tonight, and we'll plan on taking that off tomorrow morning. Is that? KiKi, you did great. You have some ointment in your eyes, so your vision is going to be a little bit blurry. Just try to relax. Take some nice deep breaths. You did wonderful. Everything's all over. Just couldn't have gone more smoothly for her. With any type of surgical procedure, the smoother it goes, that'll usually translate into less swelling and bruising for the patient.
I feel so tired.
Feel tired? Well, you've had a big day.
KiKi's swelling is going to reach a peak in about 48 hours. And after that 48 hours, her swelling will start going down. All of her swelling should be gone probably by the end of about 3 months for her.
Dr. Maloney was great. I mean, he actually made a house call to come see me the day after my surgery, which was fabulous.
Dr. Maloney, I really appreciate you coming by the house
Oh, no.
to do this.
It's my pleasure. I know it's tough to get up and move in the day after a procedure like this.
I didn't really get a chance to see too much of it because I still had my bandages on. Dr. Maloney took them off, and I was totally not prepared for the way I looked. I looked like a monster. I wish I would have been a little bit more informed of how bad my face was going to look, how swollen I was.
I'm going to get you lined up with a little support sling that I really want you to wear as much as you can over the next week.
Okay.
This sling is going to help to give us a little gentle pressure. And I'm excited that you don't have any bruising. Now, your face is probably going to, things are going to feel a little bit different because you have some numbness in the cheek.
How long will this last?
The tissues that I removed yesterday are permanently gone. The fat is permanently gone. The puffiness that you had around the eyelid areas, that is permanently gone. Most important things you can do are to avoid sun exposure and avoid cigarette smoking.
Yes, I'm so done. I'm finished.
Fantastic.
No more smoking for me.
Well, you relax, and I'll see you on Friday, okay?
Thank you, Dr.
Okay.
Maloney,
You're
so
welcome.
much. Oh, Keisha, Era, man, how do I look? Because I couldn't even, I wouldn't even recognize me. I didn't even recognize me when I looked in the mirror, y'all, for real.
There's a big difference. You can see where the skin is tighter, you know, around your eyes,
Seriously?
your chin. Yes, yes. Even with the swelling, you can see it.
I just trust y'all.
Okay.
We got you.
I'll be good.
You know, after surgery, I didn't have much of an appetite. And I noticed I lost like 3 or 4 pounds. So I'm like, all right, you know, new face, let's get the body bumping. So I went on a diet and I lost 25 pounds. So it's like new face, new body, and just tie everything in, you know what I mean? When I look in the mirror now, I see eyes that are totally symmetrical, smooth underneath, no wrinkles or anything, a great chin, no more of that double chin thing going on, great jawline, and I'm very, very pleased with it. And I'm glad I had it done. I think if I was gonna have it done at any point in my life, now was the perfect time.